Hi friends, I brought a new video for you. This video is going to be on Flytro. Flytro has Fluocinolone, Hydroquinone and Tretinoin. It's made by Tabros Pharma. It's 15 grams and the price for one cream is 120 rupees. This combination medication is used to treat melasma on the face. Melasma is a condition of dark patchy areas on the skin, especially on the cheeks and forehead. It sometimes occurs with hormone changes. This product contains three different kinds of medication. Hydroquinone is a reversible skin bleaching agent. Tretinoin is a retinoid that increases skin shedding. Fluocinolone is a medium strength corticosteroid that reduces swelling, itching and redness. This medication may improve your melasma, but it is not a cure. Continued exposure to some of the causes of melasma, which are sunlight, estrogen type birth control hormones, may cause it to return. Before using, apply a small amount of this medicine to an area of unbroken skin and check the area within 24 hours for any side effects. If the test area is itchy, red, puffy or blistering, do not use this product and contact your doctor. If there is just mild redness, then treatment with this product may begin. Begin using. Gently wash your face and neck with a mild soapless cleanser. Rinse and pat dry the skin. Apply a thin layer of medication to the affected area, including about ½ inch of normal appearing skin around the affected area, once daily, 30 minutes before bedtime or as directed by your doctor. Rub the medicine into the skin gently and completely. Do not bandage, cover or wrap the area unless directed to do so by your doctor. This medication may make the treated areas of skin more sensitive to the sun. Avoid prolonged sun exposure, tanning booths and sun lamps. Use a sunscreen of SPF 30 or greater and wear protective clothing on the treated areas of skin when outdoors, even on cloudy or hazy days. If you experience dry skin from using this product, you may use a skin moisturizer in the morning after washing your face. You may also use a moisturizer and cosmetics during the day while using this medication. Avoid getting this product into your eyes or on the inside of your nose or mouth. If you do get this medication in those areas, flush with plenty of water. If severe irritation occurs, seek medical attention promptly. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same time each day. It may take up to 4 weeks to notice significant improvement. However, this medicine is not recommended for long use, example longer than 8 weeks. Without stopping the medication for short periods, inform your doctor if your condition persists or worsen after 4 weeks of treatment. Some side effects of Flytro are mild burning, stinging, redness, dryness or acne may occur. I hope you like the video. Please like and share our channel. Subscribe to our channel. Thank you.